Have you noticed yourself clearing your throat more often than you used to? Maybe it happens the moment you wake up. Maybe you're constantly reaching for a glass of water, hoping that uncomfortable feeling will finally disappear. Or perhaps you're convinced there's always something stuck in your throat, even though every time you cough, nothing really comes up. Before we go any further, I'd like you to do something with me. Swallow once, just once. Now pay close attention to the back of your throat. Does it feel completely clear, or does it feel as if there's a thin layer of mucus that refuses to leave? If you're over the age of 60, I don't want you to dismiss that feeling as just getting older. While aging certainly changes many things inside the body, persistent throat mucus is often your body's way of pointing toward an underlying issue that deserves attention. One of the biggest mistakes I see people make is treating the symptom over and over again without ever asking why it's happening in the first place. They buy throat lozenges. They sip warm tea throughout the day. They avoid dairy because someone told them milk creates mucus. They clear their throat hundreds of times every week. Yet months pass, sometimes years, and nothing really changes. That's because mucus itself usually isn't the real problem. It's simply the messenger. And today, we're going to talk about what it's trying to tell you. My name is Dr. James Carter, and for many years I've focused on helping older adults better understand the changes happening inside their bodies. One thing I've learned is that our bodies rarely do something repeatedly without a reason. Symptoms are information. Our job is learning how to interpret that information before it develops into something much more difficult to manage. Today I'm going to walk you through 5 hidden reasons why persistent throat mucus becomes so common after the age of 60. Some of these causes are surprisingly simple. Others are often overlooked, even during routine medical visits. But what may surprise you most is this. Many people don't have just one cause. They have 2 or even 3 working together at the same time. That's why trying one home remedy after another often leads to disappointment. You're solving one piece of the puzzle while 2 others remain untouched. By the end of this video, you'll understand not only what may be causing the constant mucus in your own throat, but also which daily habits can make it significantly better over time. Before we continue, I'd love to hear from you. Is your throat worse when you first wake up in the morning? Or does the mucus stay with you throughout the entire day? Write morning or all day in the comments below. Your answer may reveal more than you realize. Now, before we discuss the first hidden cause, there's something almost everyone needs to understand first. Because once you know how mucus is actually supposed to work, everything else in this video will make much more sense. Let's begin with something that surprises almost everyone I speak with. Your body is supposed to produce mucus. In fact, it produces it every single day, whether you notice it or not. Without mucus, every breath you take would expose the delicate lining of your nose, throat, and lungs to dust, bacteria, viruses, and tiny particles floating in the air around you. Think of mucus as your body's natural protective coating. It traps unwanted particles before they can travel deeper into your respiratory system, while also keeping your airways moist enough to function properly. In other words, mucus isn't your enemy. The real problem begins when your body can no longer move it efficiently. Inside your airways are millions of microscopic hair-like structures called cilia. Although they're far too small to see, they work continuously throughout the day. Their job is surprisingly simple. They gently sweep mucus upward towards your throat, where it's swallowed without you ever noticing. It's an incredibly efficient cleaning system. At least it is when we're younger. As we grow older, however, those tiny cilia gradually become less active. They don't stop working completely, but they move more slowly than they once did. Imagine the moving walkway at an airport. When it's operating normally, people reach their destination quickly and smoothly. But if the walkway slows down, people begin to crowd together. The same thing happens inside your airways. Mucus that would normally be cleared within minutes now lingers much longer. By itself, this change may not cause noticeable symptoms. But when another condition begins increasing mucus production at the same time, that's when many older adults start feeling as though something is permanently sitting in the back of their throat. This is exactly why treating the mucus alone rarely solves the problem. It's like trying to dry a wet floor while the faucet is still running. Until you discover what's causing the excess mucus in the first place, the symptom simply keeps returning. And that's where the first hidden cause comes in. For many older adults, the source isn't actually inside the throat at all. It's something happening much lower in the body while they're asleep. What's remarkable is that thousands of people experience it every single night without ever feeling heartburn. In fact, many would never suspect their stomach had anything to do with their throat. Yet this silent condition has become one of the most common reasons specialists see chronic throat clearing in adults over 60. And once you understand how it works, you'll probably recognize several of the warning signs in yourself. Let's take a closer look. The first hidden cause is something many people live with for years without ever realizing it. It's called silent reflux. Unlike traditional acid reflux, silent reflux doesn't always announce itself with burning pain in the chest. In fact, many people who have it never experience heartburn at all. Instead, the acid travels higher than most people expect. Rather than staying in the lower part of the esophagus, tiny amounts can reach the back of the throat, the voice box, and sometimes even the nasal passages. The tissues in these areas are extremely delicate. They were never designed to come into contact with stomach acid. Even a small amount of irritation is enough to trigger a protective response. Your body immediately begins producing more mucus. From a biological standpoint, that's actually a smart decision. The mucus forms a protective barrier, helping shield the irritated tissue from further damage. The problem is that if this happens night after night, your throat never has a chance to fully recover. You wake up each morning with the familiar feeling that something is sitting at the back of your throat. Many people assume they simply need to clear it, but clearing your throat repeatedly creates another problem. Every forceful throat clear causes the vocal cords to slam together. Over time, this repeated irritation can make the throat even more sensitive, creating an endless cycle. The irritation causes mucus. The mucus causes throat clearing. The throat clearing causes even more irritation. And before long, it becomes a habit you barely notice. There are several clues that silent reflux may be contributing to your symptoms. Do you wake up with a hoarse voice that gradually improves during the day? Does your throat feel worse after a large evening meal? Do you notice more mucus after lying flat for several hours? Do you often feel the need to cough shortly after eating, even though you're not sick? Each of these signs points toward the possibility that your stomach may be involved. As we age, the muscles that normally help keep stomach contents where they belong naturally become less effective. Digestion also slows. Meals remain in the stomach longer. Pressure inside the abdomen increases more easily. Together, these changes make nighttime reflux more common in older adults. The encouraging news is that silent reflux often responds very well to simple lifestyle adjustments. We'll discuss those practical steps later in this video. But before we move on, there's another cause that often exists alongside silent reflux. In fact, many people have both conditions at the same time without realizing it. And when they occur together, the amount of mucus can increase dramatically. Let's talk about the second hidden cause. The second hidden cause doesn't begin in the throat. It begins much higher, inside your nose and your sinuses. When most people think about sinus problems, they picture severe congestion, facial pain, or a pounding headache. But chronic sinus inflammation often looks nothing like that. Instead, it develops quietly. You breathe reasonably well. Your nose doesn't feel completely blocked. You don't feel particularly sick, yet your sinuses continue producing a small amount of extra mucus throughout the day. Gravity does the rest. Instead of draining through the nose, that mucus slowly slides down the back of the throat. This is known as postnasal drip. Unlike mucus caused by a cold, postnasal drip can continue for months, sometimes even years. Because it happens so gradually, many people simply assume it's part of getting older. It isn't. It's a sign that something continues to irritate the lining of your nasal passages. For some people, it's environmental allergies. For others, dry indoor air, dust, air pollution, chronic sinus inflammation, or even structural changes inside the nose that develop over time. The important point is this: the mucus you feel in your throat may not actually be coming from your throat at all. It's simply passing through on its way downward. One mistake I frequently see is relying on antihistamines every single day without understanding what's causing the inflammation. While these medications may temporarily reduce symptoms for certain people, they can also dry out existing mucus. Instead of flowing naturally, the mucus becomes thicker and stickier, making it even harder to clear. Many ear, nose, and throat specialists recommend beginning with much simpler approaches. Keeping the nasal passages moist. using a properly prepared saline rinse, reducing exposure to known irritants whenever possible, supporting the natural cleaning system inside the nose rather than trying to suppress it. Remember the tiny cilia we discussed earlier? Those microscopic cleaners don't only exist in your throat, they're also working inside your nasal passages every minute of every day. When the nose becomes excessively dry or inflamed, those cilia become less efficient. Mucus begins to accumulate. The drainage slows, and before long you constantly feel something running down the back of your throat. At this point, you might be thinking you've finally identified your problem. Maybe you have. But before you reach that conclusion, there's one more possibility that deserves your attention. This next cause surprises almost every patient I speak with because it has nothing to do with infection, allergies, or even aging itself. It may be sitting inside your medicine cabinet, and millions of older adults take it every single day without realizing it can sometimes contribute to persistent throat irritation. The third hidden cause isn't found in your throat. It isn't found in your sinuses either. In many cases, it's sitting inside your medicine cabinet. One of the questions I often ask older patients is surprisingly simple. When did your throat symptoms begin? The second question is just as important. When did you start your current medications? Most people don't see any connection between the two. That's understandable. If a medication causes side effects immediately, it's much easier to recognize. But some medications work differently. Their effects can appear gradually, over weeks or even months, making the connection almost invisible. One group of medications deserves particular attention. These are called ACE inhibitors. They're commonly prescribed to treat high blood pressure, heart failure, and certain kidney conditions. For millions of people, they're effective and completely appropriate. But like every medication, they can also produce side effects. One of the best documented is persistent throat irritation accompanied by an ongoing urge to clear the throat. This happens because ACE inhibitors allow certain natural substances inside the body to build up over time. In some people, these substances make the nerves in the throat much more sensitive. Even a small amount of normal mucus suddenly feels irritating. The result? You clear your throat, again and again. Eventually, it becomes so automatic that you don't even realize you're doing it anymore. If you've ever found yourself clearing your throat every few minutes while reading, watching television, or talking with friends, this may be worth discussing with your healthcare provider. Please don't misunderstand me. I'm not suggesting you stop taking your medication. Never discontinue a prescribed medication without medical advice. Instead, this is about asking the right questions. If your symptoms appeared after starting a new medication, your doctor may decide to review whether another option is appropriate for you. Sometimes the solution isn't adding another medication, it's simply identifying the one that's already contributing to the problem. Now let's move to another hidden cause that affects almost everyone as they get older. It's so common that many people don't even recognize it's happening. And unlike the previous causes, this one can influence every cell in your body, including the mucus lining your airways. I'm talking about hydration, not simply how much water you drink, but how your body handles water after the age of 60. When people hear the word dehydration, they usually imagine someone who hasn't had a drink all day. That's rarely what we're talking about. Most older adults experience something much more subtle. A mild, ongoing state of dehydration that develops little by little over months or even years. One of the reasons is surprisingly simple. As we age, our sense of thirst becomes less reliable. The body doesn't send the same strong signals it once did. You may need water long before you actually feel thirsty. Meanwhile, your mucus continues losing moisture. Imagine trying to spread honey straight from the refrigerator. It's thick, sticky, slow to move. Now imagine warming that same honey slightly. Nothing about its ingredients has changed, only its consistency. Your mucus behaves in a very similar way. When your body has enough fluid, mucus stays thin enough for those tiny cilia we discussed earlier to move it efficiently. When you're mildly dehydrated, the mucus becomes heavier, thicker, more difficult to clear. That alone can create the constant sensation that something is stuck inside your throat. Hydration isn't just about drinking one large bottle of water in the evening. Your body benefits much more from consistent intake throughout the day. Water, herbal tea, broth-based soups, fresh fruits, vegetables with high water content. All of these contribute to healthy hydration. But hydration is only one piece of the puzzle. The quality of the air you breathe also matters. During colder months or in air-conditioned homes, Indoor air often becomes much drier than people realize. Dry air slowly pulls moisture away from the delicate tissues inside your nose and throat. Your body responds the only way it knows how. It produces more protective mucus. Sometimes the environment around you is quietly contributing to the problem every single day. If your bedroom feels dry when you wake up each morning, or if you often sleep with your mouth open because of nasal congestion, your throat may be losing moisture for hours while you sleep. Simple adjustments, such as improving indoor humidity or addressing chronic mouth breathing, can make a noticeable difference over time. However, there is one final hidden cause that ties everything we've discussed together. It's a connection researchers have only begun to fully appreciate over the last decade. It starts deep inside your digestive system. Yet its effects can reach all the way to your lungs and your throat. And once you understand this relationship, you'll begin to see why treating symptoms alone is rarely enough. Let's explore that final piece of the puzzle. Now we've reached the final piece of the puzzle. Throughout this video, we've talked about your throat, your stomach, your sinuses, your medications, and your hydration. But there's one more system quietly influencing all of them: your gut. For many years, doctors thought of the digestive system and the respiratory system as two completely separate parts of the body. Today, we know that's not the case. The bacteria living inside your digestive tract communicate constantly with your immune system. Those signals influence inflammation throughout the body, including the tissues lining your nose, throat, and lungs. When your gut microbiome is healthy and diverse, your immune system tends to respond in a more balanced way. When that balance is disrupted, the body may become more reactive, producing unnecessary inflammation that contributes to a variety of chronic symptoms. Persistent throat irritation can sometimes be one of them. What disrupts the gut microbiome? There isn't one single cause. Years of highly processed foods, too little dietary fiber, repeated courses of antibiotics, long-term stress, poor sleep, limited physical activity. None of these factors usually create symptoms overnight. Instead, they slowly shift the environment inside your digestive system until your body's normal balance becomes harder to maintain. The encouraging news is that improvement also happens gradually. Small choices repeated consistently often produce greater results than dramatic changes that last only a few days. Adding more vegetables, choosing fiber-rich foods, including fermented foods that contain live cultures if they're appropriate for you. Staying physically active, prioritizing quality sleep. These habits support much more than digestion. They support the entire communication network between your gut and your immune system. Before we finish, I want to mention something very important. Most cases of persistent throat mucus are not medical emergencies. However, there are situations where you should not wait or rely on home remedies. Please arrange a medical evaluation if you notice blood mixed with mucus, progressive difficulty swallowing, unexplained weight loss, a persistent lump in your neck, severe pain that doesn't improve, or a voice change lasting several weeks without an obvious explanation. These symptoms deserve professional assessment. It's always better to investigate early than to ignore something that continues getting worse. Now let's bring everything together. If you only remember one thing from today's video, let it be this: don't focus on removing the mucus. Focus on removing the reason your body keeps making it. Think of today's information as a 5-step recovery system. Step 1. Identify where the irritation is coming from. Is it your stomach, your nose and sinuses, a medication, dry air, or several of these at the same time? Step 2. Reduce the irritation. Simple habits such as avoiding heavy meals close to bedtime, managing reflux, supporting healthy nasal function, and discussing possible medication side effects with your healthcare provider can reduce the signals telling your body to produce excess mucus. Step 3. Help your body clear mucus naturally. Stay consistently hydrated throughout the day instead of waiting until you're thirsty. Support healthy indoor humidity when the air is dry. Avoid unnecessary throat clearing whenever possible, because repeated throat clearing often prolongs irritation rather than relieving it. If you feel the urge to clear your throat, try taking a small sip of water or swallowing gently first. For many people, that simple habit helps interrupt the cycle. Step 4. Support your body's long-term healing. Healthy sleep, regular movement, a balanced diet rich in whole foods, adequate fiber, good digestive health. These habits don't produce instant results, but they create the conditions your body needs to recover. And finally, step 5. Be patient and consistent. Your throat didn't become irritated overnight. It usually won't recover overnight either. Give your body time to respond. Small improvements repeated day after day often become meaningful changes after several weeks. Before we end, let's clear up a few common myths. Many people believe honey can cure chronic throat mucus. Honey may temporarily soothe an irritated throat, and many people find it comforting. But by itself, it won't correct reflux, chronic sinus inflammation, medication-related irritation, or dehydration. Others believe dairy automatically creates mucus. Current evidence doesn't support that idea for most people. Some individuals may feel that dairy makes existing mucus seem thicker, but that experience isn't universal. Pay attention to your own body rather than assuming everyone responds the same way. You may also hear that one special drink, one supplement, or one home remedy will eliminate chronic mucus within a day or two. Be cautious with promises like that. When a symptom has been developing for months or years, lasting improvement usually comes from understanding the cause and addressing it consistently, not from searching for a quick fix. I hope today's conversation has helped you look at this symptom differently. Persistent throat mucus isn't simply something you have to accept because you're getting older. More often than not, it's your body's way of asking you to pay attention. When you understand the message, you can begin making choices that support the underlying cause instead of constantly fighting the symptom. If you found this video helpful, I'd love to hear from you. Which of the 5 hidden causes surprised you the most? And how long have you been dealing with persistent throat mucus? Share your experience in the comments below. Your story may encourage someone else who's been quietly struggling with the same problem. If you enjoy practical, evidence-based health information designed specifically for adults over 60, be sure to subscribe and turn on notifications. In our next video, we'll explore another surprisingly common symptom that many older adults overlook until it begins affecting their daily life. Until then, take good care of yourself, stay curious about your health, and remember that understanding your body is one of the most powerful steps you can take toward protecting it.